Stage B1, in which there was cardiac disease but no evidence of cardiac enlargement, received the following recommendation. The group reached consensus that no drug or dietary therapy was recommended here. This means then that 10 out of 10 of the panelists felt that this was the right approach. Stage B2, dogs who have cardiac enlargement but are not yet showing clinical signs of heart failure, received the following recommendation. For the use of ACE inhibitors, no consensus was reached. There was, however, a majority of the panelists felt that ACE inhibitors were useful in the treatment of mitral valvular disease prior to the onset of heart failure after cardiac enlargement was recommended. A minority of the panel felt that no treatment should be advocated at this time, pending further clinical trials. The background to this recommendation involves two placebo-controlled double-blind trials, one done in Europe and one done in the United States. The first of these, the SVEP trial, which is the Scandinavian Veterinary Enalapril Prevention Trial, showed no benefit in delaying the onset of heart failure when placebo was compared to enalapril. It's important to recognize that this study should not be over-interpreted, and the reason for this is that it looked at only one breed of dog. This was the Cavalier King Charles Spaniel. Secondly, these dogs had relatively mild mitral insufficiency, with only half of the dogs actually having cardiomegaly when they entered the study. And finally, the dosage was significantly below the manufacturer's current recommendation of 0.5 to 1 milligram per kilogram per day. These dogs received on average 0.37 milligrams per kilogram per day. Nevertheless, no benefit was shown. The second trial, which bears our scrutiny, was the VET-proof trial, which was the veterinary enalapril trial to prove reduction in onset of failure. And this was a group of dogs in which there were 24 breeds examined. They had cardiomegaly. There was a placebo-controlled design, and dogs which exited the trial in the first 60 days were not included in the final analysis. And what we see from the Kaplan-Meier survival curve before us is that there was reasonable separation between the group receiving enalapril on top and the group receiving placebo on the bottom. You can see that at day 500, significantly more dogs had gone into heart failure when they received placebo than those that received enalapril. If we look at the end of the trial, twice as many dogs receiving enalapril lasted the whole trial without going into heart failure as compared to those receiving placebo. The overall curves failed to reach significance, but the p-value was 0.06, strongly suggestive of a significant relationships clinically. The benefit was rather modest, however, at about 4 months delay in the onset of heart failure as a median value. Nevertheless, as an author on this paper, I believe that this did show that ACE inhibitors do delay the onset of heart failure, albeit modestly, in dogs with mitral insufficiency treated at approximately 0.5 milligrams per kilogram per day. As further background information for this recommendation, a recent survey of approximately 100 ACVIM boarded cardiologists in the United States indicated that 70% felt that chronic ACE inhibition was warranted in mitral valvular disease of stage B2. So while this is controversial, the majority of veterinary cardiologists do feel that ACE inhibitors are beneficial prior to the onset of heart failure in dogs with mitral valvular disease with remodeling changes evident.